Hi guys, fellow aligner providers and dental colleagues. Thank you so much for DMing me and telling me about the huge impact these three questions can have. It's amazing how a small, simple thing can have such a big and explosive impact. We're now going to go to the other end of the market and talk about a needs-based patient. A needs-based patient is a patient who values their oral health. They attend regularly for a checkup, and at present they are unaware that they have a problem with their teeth. They are unaware that they are either holding a upgraded risk profile, or they're unaware that there are things we can do to increase the prognosis of their oral health. And in general, there are three things or three conditions that we can look after or look more towards. Excuse me for fumbling my words. So if we think periodontally, we will all have patients with lower anterior crowding or lingually inclined teeth. If this person is struggling to keep their teeth clean and yet everywhere else is healthy, we understand that interceptive orthodontics can improve the prognosis of their gingival health, and it can downgrade their risk of future periodontal problems. So there are two scenarios that we've just explained, whereby co-diagnosis and education, we can engage with a motivated person and ask if they feel that straightening their lower teeth would help to improve the health of their gums. And there's a third condition which lends itself to what we call interceptive orthodontics. It's what's called a constricted chewing pattern, long centric. There are different words to describe this, but in essence, it's a class 2 div 2 patient classically. When they close, there's friction. So there's friction or rubbing on closure if we go back to Posselt's envelope or function. What that means is that when they close their teeth together, rather than that movement being passive, there's rubbing and friction, which takes out the labial enamel of the lower incisors and the palatal enamel of the upper incisors. What this person needs is room. So we yet again have an opportunity where for a class 2 div 2 person who has accelerated wear or accelerated aging, we are able to provide some form of orthodontics, which is interceptive. What that means for that person is it reduces the risk of their teeth aging them, and it improves the prognosis of their teeth as they get older. So guys, I hope that tomorrow when you go to work, you're going to have a look at your patients and have a look at which patients can we offer some form of interceptive orthodontics, whereby we can downgrade their risk of future problems or improve the prognosis, so that we know that we've done our best to maintain optimal oral care. So guys, thank you so much for your time today. It's 3 minutes now, so sorry about that. What I'd love for you to do is to like this, share it, tag me, DM me with your thoughts, and come back to me with more ideas, because what we want to do is to share ideas amongst ourselves as professionals so we can get our own sort of body of best practice. Thanks a lot, guys. Speak soon.